So, what do I typically do as a cardiologist? What's going on? My name is Dr. Isang, and I'm a general non-invasive cardiologist. So, what do I typically do? How long does it take to become a cardiologist? How long does it take to become a doctor? Are these all the same things? So, the first one is, how long does it take to become a doctor? So, it's 4 years of undergrad. It is then 4 years of medical school. While you're in medical school, you're going to look at the different types of doctors that you could potentially be, whether it's internal medicine, family medicine, pediatrics, obstetrics and gynecology, surgery, anesthesiology, radiology, neurology. There's a bunch of it, urology. So during those 4 years, the first 2 years is didactics, where you'll be learning about medicine, learning about the anatomy, the physiology, the pathology, and kind of blending things together for those 2 years, taking exams to make sure that you're clinically ready, competency-wise, for rotations, which is the next 2 years. Um, Usually in the first year of the 2 years, years three, you do your general rotations. So you are going to do internal medicine, pediatrics, family medicine, obstetrics, and surgery. Then for your fourth year is more of an elective, where you'll do the things that you think that you want to do. Hopefully within that first year, you've gathered some insight about what you want to do, whether that's surgery, internal medicine, or something like dermatology, anesthesiology, radiology, etc. So after you've done that, boom, you've graduated. You are now a doctor. But that means nothing because you cannot practice yet. You need to complete a residency in the United States of America. Whether you found, so after you've found what you want to do, you apply for residencies, which can be anywhere from 3 years, something like family medicine, internal medicine, but it can go upwards to 7 to 8 years, especially if you're doing a combined program where you combine general surgery and CT surgery into one, or something like neurosurgery, which is typically around 7 years. So, boom, you've done 4 years of undergrad, you've done 4 years of medical school, and you've done 3 years of internal medicine, like I did. 4, 4, 3, 8, 3, 11. So 11 years to become an internal medicine doctor, where you can do inpatient, outpatient, a mix of both. I did inpatient medicine. I was a hospitalist, but mostly a nocturnist. I was a hospital doctor where I only saw patients in the hospital, but mine was specific because I only saw people at nighttime. So I was a nocturnist for about 2 years. I knew that I wanted to do a little bit more, so then I sought for extra training. And that's where I reapplied and applied for cardiology and was accepted into cardiology fellowship. Cardiology fellowship is 3 years. So 4 years of undergrad, 4 years of medical school, 3 years of internal medicine, and then 3 years of cardiology fellowship, giving you a total of 14 years to become a non-invasive or general cardiologist. In the world of cardiology, you may want to subspecialize into a lot of different other aspects. You can do interventional, which is typically 1 year. You can do structural, which is typically 1 year after you've done interventional. So some of my friends are interventional structural specialists, so they've done 2 years of that. You can do electrophysiology, which was previously 1 year, but now it is 2 years because of the world of electrophysiology, or EP, is growing that much. You can do heart failure, which I believe is 1 year. Imaging can be 1 to 2 years. Congenital can be 1 to 2 years also. So you're looking at anywhere from as little as 14 years to become a general cardiologist, upwards to 16 years of medicine of training to become a interventional structural cardiologist. So it's a daunting task. So I always tell people, if you want to become a doctor, don't do it for money. You can do a lot of other different things to make money, but also not accrue as much as debt as it takes to becoming a doctor, to becoming a cardiologist. Is it worth it? For me, 100%. If I could do it again, I would do it again. I would hope that I would do things a little bit differently, so I wouldn't have had the same hurdles that I had to jump over like I did previously. It took me two application cycles to get into to get into medical school. It took me three application cycles to get into cardiology fellowship. There were things, there were warning signs that were there that I didn't listen to, unfortunately, that made things a little bit more difficult. But also those difficulties that I went through were 100% worth it. Not getting into cardiology fellowship in those multiple attempts meant me being able to travel the world, meant me being able to welcome my son, meant me being able to be a husband for the first time because my wife was doing her OBGYN residency in New Jersey while I was doing my internal medicine residency in Knoxville, Tennessee. So we were doing long distance marriage for 3 years. So those was a big hurdle, difficult. Don't recommend it. Don't do it. But gave us the opportunity to kind of reunite and kind of learn how to live together. So used to being apart, so used to doing our own things. My thing back in the day was eating cereal at nighttime. Can't do that when you're married living. You gotta have a formal dinner time. You gotta have formal lunch. You gotta have formal meals and not just have Cheerios for breakfast, lunch, and dinner like I used to back in the day. So that was the probably the more difficult aspect of becoming a cardiologist was the time away and the hurdles that I had to jump, overcome to get to where I am right now. Is it worth it? Once again, 100%. I would do it again. But to recap, it takes 11 years to become typically a general internal medicine doctor. It takes 14 years to become a general cardiologist, and an additional 1 to 3 years if you want to do more specialties. So to answer the question, back to the question. So what do I typically do? What is my typical day as a non-invasive cardiologist? So what exactly is a non-invasive cardiologist means, once again, I've done those 14 years. So what can I do? I can do certain procedures, specifically transesophageal echocardiograms. This is when I put a tube through the mouth to look at the heart, look at how the heart is squeezing, look at the heart valves, look for any fluid around the heart, mostly to look for clots in the specific area of the heart known as the left atrial appendage. If there's a clot, it prevents us from doing a cardioversion where we shock people back into normal rhythm. One of the most common reasons that we're doing this procedure is for something called atrial fibrillation. This is an abnormal rhythm that comes from the top part of the heart that can lead to clots. So we need to clear the clot first, or clear the heart from having a clot, so that we can shock them back into normal rhythm, understanding that those individuals need to be on blood thinners to prevent those clots from occurring in the future. But it depends on my inpatient and my outpatient days. During my inpatient days, we're structured where we have 3 inpatient teams, and we alternate consults during the day, and then we also alternate who was the short-term, long-term, and no-call person. Long-term call person is on call for about 24 hours. Short-term call person is on call for about 10 hours. And a no call doesn't have any call responsibilities, just has to see your patients and then see their morning consults. Everything gets spread out throughout. And we do that for about either 7 days straight, or you can split it and do 3 and 4 days splits if 7 days is too much. There are advantages and disadvantages to both of them. I typically split mine apart, but also have some that days where I am doing 7 days straight, typically starting on a Friday and ending on a Thursday to give myself a long weekend off when I'm done Friday, Saturday, Sunday, sometimes Monday. But that's my outpatient duties. That's my inpatient duties. My outpatient duties is typically seeing patients throughout the day, reading EKGs, reading echocardiograms, ultrasounds of the heart, transthoracic, reading stress tests, whether that's inpatient or outpatient stress tests, and just trying to see and provide good care. I like to call myself just a regular country doctor, and seeing patients and treating them how I would want to be treated. But that's typically what my day flows like, and the beauty of my program is that we're able to tailor it to how we want to, whether you want to do more outpatient, have a mix, or have more inpatient, or have more procedures where you can do heart catheterizations to look for blockages, understanding that if you're not an invasive cardiologist, you can look for those blockages, but if those blockages need to be fixed, it needs to be sent to the interventional cardiologist. I don't do heart catheterizations anymore, just because I wasn't the best at it. And if I wasn't going to be able to fix it, I didn't want to do it at all. I would rather give it to my partner who can do everything all at the same time, giving them an all in one experience versus doing it and asking to ask for help. A lot of my colleagues do that, and I have no issues with it. Just me personally, I wasn't that good at it, and I wanted to be able to fix my own things if I could. Knowing that I can't, I completely am happy where I'm at, where I am. Kind of like their hype man, helping them understand what's going on. If something needs to be treated, we can treat it with a heart catheterization. We can treat it with certain medical therapies. We can treat it with lifestyle changes. We can treat it with sometimes a pacemaker. I like general cardiology because you get to see the bread and butter in medicine, whether that's heart failure, atrial fibrillation, chest pain, palpitations, and and I just like it. I mean, that's some people who see what I do couldn't do it because they're more tailored towards the outpatients, inpatient procedure heavy setting versus I'm more sit laid back. Let's talk about how this happened. Let's talk about what led to you to coming to see me in the office. My name's Dr. Isang. If you got any questions about what it takes to become a doctor, cardiologist, husband married to someone who is also a doctor, the struggles that is associated with, leave it in the comments. Once again, I love this job. Took a long time to get here. It may not be for everybody, 14 years plus, but it was for me. It was for my wife too. Hers was 11, 12 years, I believe. I believe it was 12 years. Her residency is 4 years, so and hers was even more difficult because fellowships were typically 3 to 4 years. She didn't do a fellowship. She's a general OBGYN. But you got any benefits from this, subscribe to the channel. Let me know in the comments what you would like to know more regarding becoming a doctor, regarding becoming a cardiologist, regarding the struggles that I went through and how I was able to overcome it. Once again, I had to reapply several times. Dr. E saying, you guys have a good day or night or evening.